It's quite possible you've observed a rise in age-related cognitive problems, like Alzheimer's disease and various forms of dementia, popping up all over the world. The World Health Organization has stated that over 55 million people are currently struggling with dementia. Considering how increasingly common it's becoming, I genuinely believe that it's crucial for anyone over the age of 40 to educate themselves and discover strategies for prevention. So today, we're going to delve into some commonly prescribed medications that could significantly increase your chances of developing dementia. Specifically, we'll be taking a look at 7 distinct categories of drugs that have the potential to worsen cognitive decline and impair your memory. And even better than that, we'll also be sharing some helpful information on what you can do to help reduce those risks. Just a friendly reminder, it's always a smart idea to talk with your doctor before making any changes to or stopping any medications you've been prescribed. With that said, let's get into the specifics of each of these medications. First up, anticholinergics. The first group we're going to examine is anticholinergic drugs. These are frequently used to manage a pretty wide range of conditions. To give you a few examples, some common allergy medications, certain over-the-counter sleep aids, or even prescription drugs specifically designed for bladder control issues could potentially amplify the risk of dementia. This includes fairly common medications like diphenhydramine, often used to suppress coughs, or oxybutynin and amitriptyline. While these medications can be genuinely beneficial for the specific ailments they're designed to treat, overuse or unnecessary use, particularly among older individuals, can substantially increase the risk of dementia. According to the findings of a 2015 study published in the JAMA Internal Medicine Journal, older adults who were taking these anticholinergic medications more frequently and for longer periods of time showed a 54% greater risk of developing dementia compared to those who didn't take them at all. The effect that these drugs have on your system is dose-dependent, which means that the more of the medication you take, and the longer you continue to take it, the higher your likelihood of developing dementia becomes. These drugs work by interfering with a neurotransmitter called acetylcholine, which plays an extremely vital role in brain functions such as memory formation and learning. Unfortunately, blocking acetylcholine through the use of these medications can accelerate the cognitive decline process. Number 2, antidepressants. Coming in second are medications that are commonly prescribed for depression and anxiety disorders, and we're specifically talking about tricyclic antidepressants, including medications like amitriptyline, nortriptyline, and clomipramine. While these drugs are often effective at alleviating the symptoms of depression, research has indicated that excessive or unnecessary use of these medications can potentially increase the risk of dementia and hasten cognitive decline. A 2018 research study that appeared in the Journal of Clinical Psychiatry discovered that people who were using these antidepressant medications for extended periods of time had a 30% higher risk of developing dementia when compared to individuals who didn't use them. The study I just mentioned suggested that the anticholinergic effects associated with these tricyclic antidepressants are likely to contribute to cognitive decline, ultimately disrupting both memory and learning abilities. Secondly, these medications also tend to have a sedative effect, which essentially puts the brain into a sleep mode. This can further impair important brain function, and the risk is amplified with higher doses and prolonged use, especially in older adults and those people who are already at a higher risk of experiencing cognitive decline. Number 3, benzodiazepines. The third category that we need to discuss is benzodiazepines, which are frequently prescribed for people who are dealing with sleep disturbances, anxiety disorders, or just about any condition where some form of sedation is required. These include medications like diazepam and alprazolam. Brand names like Valium and Xanax are, of course, extremely well known in this category. Short-term use of these medications under the careful supervision and guidance of a qualified medical professional can definitely be helpful for treating these types of conditions. However, many people often develop a dependence on these drugs, feeling like they simply can't fall asleep without taking them, and they continue using them for extended periods of time, which can significantly increase their risk of eventually developing dementia. In 2014, several research studies involving older adults revealed that those who were using these types of drugs for a period of over 3 months demonstrated a 51% higher risk of developing dementia when compared to individuals who didn't use them. It's important to keep in mind that this risk is dose-dependent, which means that the higher the dosage and the longer you use them, the greater the overall risk of developing dementia becomes. According to research, Benzodiazepines appear to contribute to cognitive decline by suppressing the central nervous system, which in turn disrupts important brain function and memory. Also, these drugs also tend to have a sedative effect, making people feel sluggish and drowsy throughout the day. Number 4. Statins. Fourth on our list are statins, which are commonly used to help lower cholesterol levels. Among the statins that are available, atorvastatin, simvastatin, and rosuvastatin are all pretty popular choices. These drugs work by effectively reducing cholesterol, which in turn helps to reduce the risk of heart disease and stroke. However, according to the most recent research, excessive use of these medications can have a negative impact on your overall brain health. A 2020 study indicated that fat-soluble statins, which are able to cross the blood-brain barrier and directly affect the brain, increase the risk of problems such as memory loss. The study suggested that these specific drugs interfere with cholesterol metabolism within the brain, and it's worth remembering that a significant portion of the brain is actually composed of cholesterol. It was also observed that statins that do not cross the blood-brain barrier didn't seem to increase the risk of dementia. It's also important to keep in mind that the potential benefits of statins for your heart health often outweigh any potential risk of dementia. But even so, if a person is already dealing with multiple health issues, it's always best to have a conversation with a qualified doctor about it. Number 5. Opioids. Fifth on the list are opioids, which are typically used to relieve moderate to severe pain. They're primarily used to manage intense pain following a surgery or a traumatic injury, and they can be very effective in those situations. Common opioid medications include oxycodone, hydrocodone, and morphine. While these drugs can be incredibly effective at reducing pain, excessive use of them can increase the risk of dementia and accelerate cognitive decline. A 2021 study showed that people who used opioids for extended periods of time had a significantly higher risk of developing dementia when compared to people who didn't use them. Opioids can impair normal brain function by disrupting neurotransmitter systems and actually reducing neuroplasticity. Furthermore, opioids also tend to have a sedative effect, which reduces physical activity and can contribute to cognitive decline. Number 6. Proton pump inhibitors. Sixth on our list are proton pump inhibitors, often called PPIs, which are used for various stomach-related issues, and they can also potentially increase the risk of dementia. These medications are typically prescribed for conditions like heartburn, stomach ulcers, and acid reflux. Common examples of PPIs include omeprazole, esomeprazole, and pantoprazole. These drugs work by reducing hydrochloric acid production in the stomach, which provides significant relief from those symptoms I mentioned earlier. However, according to recent research, they can also have adverse effects on our brain health. A 2016 study found that people who were using proton pump inhibitors for extended periods of time had a higher risk of developing dementia. The study indicated that older adults who were taking PPIs on a daily basis had up to a 44% higher risk of developing dementia compared to those who weren't taking them. Research suggests that the increased risk of dementia from PPIs may occur through several different mechanisms. One prominent theory is that they have an effect on beta amyloid and tau proteins in the brain, which can ultimately increase the risk of Alzheimer's disease. In addition, PPIs can potentially lead to poor absorption of certain vital nutrients, such as vitamin B12 and magnesium, resulting in deficiencies that can, in turn, contribute to cognitive decline. Number 7. Antipsychotics. Seventh and last on our list are antipsychotics, which can also increase the risk of dementia. These medications are generally used to treat severe brain disorders, such as schizophrenia, bipolar disorder, or very severe cases of depression. Common antipsychotics include risperidone, olanzapine, and quetiapine. These drugs can certainly be life-changing for those people who genuinely need them. However, according to the latest research, particularly with regard to older adults, they can also have detrimental effects on overall brain health. A 2019 study found that older adults who were using antipsychotics had a significantly higher risk of developing dementia, especially when these medications were being used for extended periods of time. These antipsychotic drugs tend to affect neurotransmitter systems within the brain, which can accelerate cognitive decline. Furthermore, these medications also tend to have a sedative effect and reduce mobility, both of which can negatively impact overall brain health. So, if someone is currently taking antipsychotics and is experiencing increasing cognitive decline or forgetfulness, it's always best to have a conversation with a qualified medical doctor about it. Those are 7 specific types of medications that could potentially increase your overall risk of developing dementia. If you are currently taking any of these medications and are experiencing any problems with forgetfulness, it's important to talk to your doctor and only use them for the duration and dosage that they recommend. Thank you so much for watching this video and visiting the channel. I really hope you enjoyed the video. If you liked this video, please give it a like and share it with your friends. And if you are visiting the channel for the very first time, please remember to subscribe. We will meet again in the next video. Until then, take care.